And just to bring our proceedings to a close, we're just going to hear final closing comments from the IFPMA Director General, Dr. David Reddy.
So thank you very much for joining us this evening. And thank you so much for the panelists and Asai for his for wonderful remarks. I've got a script, but I'm going to go way off script right now, so please just excuse me. I've just written a few notes, and just to follow some of the narrative, I think what I really enjoyed today was just the theme and the flow that was coming through. So Ricardo, you very eloquently started off with some of the challenges, both financial and socio-political. And I think feeding into that, the comments we've just heard also, from Asai on the difficult decisions that have to be made in the context of the current environment. Kerry, you put data around this, and I think it's really good to reflect on some of the OECD statistics which really begin to quantify some of the challenges that are in front of us. Janelle, you looked at the other side of that coin, and that is, the innovation in healthcare and the prize if we can get this right in terms of health gains for people, for societies, economic gains, that are tremendous. And this really feeds into the whole case for investment and for action. I just want to make a bridge now into how. And I think, throughout this week, we're going to hear a lot of the same types of things, but I just want to reflect a little bit on the how. So, Kerry, again, you mentioned let's not forget the lessons learned. Some of the lessons during the pandemic were hard. They were hard lessons, and they cost this global community a lot, economically and just in terms of personal pain. And we shouldn't let what they have taught us about the importance of healthcare slip out of mind so easily. Janelle, you mentioned about a common goal here, and I think that's part of what it takes to get to where we want to be, and that's putting the problem at the centre, leaving a lot of the ideological stuff at the side, and trying to work towards a common goal. Ricardo, in order to do that effectively, I liked something you said. You said, don't close channels of communication. And I think we do that too easily. We listen to people who say similar things to ourselves and ignore those who may have different but valuable perspectives. If I can mention something you didn't say tonight, but has always resonated in my interactions with you, and I've been really privileged, and I've learned so much from you, and that is the concept of humility. And I've seen him wade into areas of conflict that I have been involved in and actually use those words and help calm the waters and get people to talk constructively and listen to one another. And I think listening is key to this. And the other element is assuming positive intent. Now, it's heartening to hear that a lot of leaders are stepping forward and reaffirming their commitment, but as you said as well, that goes with accountability. Holding them accountable, holding one another accountable, holding ourselves accountable for what we say we will do. Because again, we are part of a global health community. Effectively, we're a family. There are always going to be differences of opinion in a family and those who you like more than others. It's just the way, if you look at your extended family, that's just how it is. But in times of crisis, families pull together, and that's what we need to do at this time. I also heard to be bold and to challenge, and I think that will be absolutely critical. And if I can just give you an example of what this looks like, positive intent, listening, etc. There's a great book by Adam Grant called Think Again, and he talks about the vaccine whisperer. And for people in this room, myself included, we often look at vaccine skeptics and we say, if only they understood the facts. We start from a position of we challenge their beliefs with our facts, and so it goes around and around and nobody gets anywhere. You don't start with common ground, and the common ground is that actually those people have the best interest of their children at heart. And so assume that and say, I know that you want the best for your child, so let me hear what your concerns are. Let me perhaps provide some different perspective and information and just try and inform. So that's what positive intent, that's what listening, that's what humility looks like. So I think we've heard today a really great narrative that goes right from the problem, right through the case for action, investment, and then also into the way we behave. And I'd just like to thank the panelists, Sai, Shuli, and thank all of you, and hope that as we have refreshments later, we can continue this really constructive dialogue that was started this evening. Thank you all.